House Budget Director Mick Mulvaney joins us from Washington. Good morning, Director.
Good morning, and thanks for having me.
Let me ask you, when all is said and done, will the Republican health care plan cover more Americans or less Americans than Obamacare?
We really think it will cover more. Keep in mind, it's easy to claim success under Obamacare when you had a government mandate, because you could sort of say, well, everybody's covered. But is that really the question? The question is not, if you get sick, you don't really care if you have insurance. You care whether or not you can get health care. And that's where we think Obamacare came up so short. It was created a system where it was affordable to buy insurance, but not affordable to actually go to the doctor. And we think that the House introduced last night, that we worked with very closely with the House in support, actually provides more affordable health care for people, so when they do get sick, they can afford to go to the doctor.
I know that you were hoping to do an across-the-board tax credit for everyone, but the new plan phases the credits out for individuals making $75,000 a year or families making $150,000 a year. Why the change?
We just had input from a bunch of different folks, and some people were uncomfortable as we started the negotiations with allowing folks who are making more than that to sort of get this tax credit. What was it designed to do, by the way? It's only designed to cover people or to assist people who don't get coverage at work.
Director, one of the key changes here is that you're eliminating the government's mandate that you must have health insurance and replacing it with a penalty for a lapse in coverage and increase in premiums. How exactly is that going to work?
It's called continuous coverage, and it's sort of how we've proposed to deal with this concept called adverse selection. One of the problems with Obamacare now is that you can wait to buy insurance till after you get sick. And what we try and do is give people an incentive to go off and say, look, if you're really worried about that, go up and sign up now and make sure that you can prove that you've had continuous coverage. And then if you do get sick, you can't lose your coverage.
But if you have a penalty kicking in if your insurance lapse, won't that ultimately discourage people from getting back into the insurance market?
No, I think the exact opposite. It would encourage people, especially young, healthy people, one of the groups that Obamacare was never able to get into the system. It's one of the reasons that Obamacare was such a dismal economic failure.
What can you tell us, Director, about the cost of this plan? Because right now, the Congressional Budget Office hasn't reviewed it.
Right. We don't expect the Congressional Budget Office to give us any numbers for the next couple of days, but at the Office of Management and Budget and a couple other agencies, including HHS, we've run our own numbers. We're absolutely convinced that because of the efficiencies that we drive, for example, we're giving states for the first time more control over their own Medicaid money. We really do think, it sounds like it's fairly esoteric, down in the weeds, those types of innovations, allowing states to have more control over their Medicaid money, drive tremendous long-term savings.
Director, one of the things that the Republican plan does keep coverage for pre-existing conditions. Let me ask you about preventative care. One of the things that Obamacare did was expand coverage and mandate coverage for preventative care, such as mammograms, contraceptive care, also mental health screenings. Will that continue under this Republican plan?
Yeah, the way we get at those things is a dramatic expansion of health savings accounts so that you can use your pre-tax dollars. We double the size of them, or nearly double the size of them, and then dramatically increase where you can use them. So we do feel that people will still have the ability to get that type of care in a very affordable fashion.
All right, Director Mulvaney, thank you for joining us.